Namaste. I am Dr. Jacqueline Koay and I'm the founder of Sun Yoga. When I'm not traveling around the world teaching yoga teachers, what I do is I am working for Dr. Ahmad Mediana in Jakarta. Ahmad Mediana's work is on the well woman. We look after women from the preconception stage, which means infertility treatment, right through to pregnancy, birth, menopausal, and postmenopausal. The clinic and the hospital we work at is specializes in women's health. Obviously, I bring in a lot of my work as a yogi into my hospital work. And when it comes to prenatal care, we actually train women yoga techniques and we encourage them to use holistic methods such as good nutrition, good exercise, and having a positive state of mind. All these totally helps with the birth process. Like, for example, we are proponents of natural childbirth. So in the delivery room, we do encourage our patients to move around to find the optimal birthing positions for them. It might mean squatting all on fours, it might mean lying on the side with a partner holding her from behind. It is whatever the body demands because women have been birthing children since the beginning of mankind, humankind, I should say. The female body does know how to birth a baby or two babies or three. So we would generally go along with the flow with what the woman wants to do, whatever compels the woman to do in the moment of labor, driven by the primal sense. We absolutely encourage the women to stay healthy, to move around, and to go with the flow of the body. I am a mother of 5 myself, and I would absolutely love to have a home birth, a water birth even. Unfortunately, I have a blood condition called beta thalassemia and also have low clotting factor in my blood. It is not possible for me to deliver at home safely, even though I lived quite near to a hospital. In any event, I did hemorrhage when I gave birth to my third son. Now, many people are fearful of hospitals, but hospitals are not necessarily a bad place. It is somewhere that you can deliver your babies as safely as possible with the backup of modern technological equipment that you sometimes need. 2 reasons why women need hospital birth, or maybe I should say 3. One is the condition of the woman. If you have any particular problem, maybe it's you have a blood problem like me, hospitals are really the place to be in case you hemorrhage or there's any unforeseeable circumstances. For some women, it's prolonged labor when the labor is not progressing and the babies are getting distressed. They start opening their bowels and there's meconium in the amniotic fluid, which is potentially very dangerous. So when labor is not progressing, hospitals are really the place to go where the baby can come out as soon as possible. The third reason that we see quite a lot in Indonesia is retained placenta. The placenta is not coming out, so surgical intervention is needed. I just want to tell you a little bit about what we do in an operating theatre. We try to keep our operating theatre as yogic as possible whilst following very strict WHO guidelines. The first thing we do is we follow principles of saucha, which is cleanliness. Saucha is a yogic term. It's the second law, is niyama. And cleanliness means that we try, first of all, in the physical environment, we keep it as sterile as possible. And because our operating theatre is very simple compared to the modern Western ones, it makes it very easy to keep clean. We also limit the number of personnel in the room, so we don't allow fathers in the operating theatre for that reason. And we have the minimum required numbers of staff in there. Typically 4 doctors and anesthesiologists and a couple of support nurses. We also keep movement of the operating theatre to the minimum, so you do not see this busy, bustling place that you do in television programs. You see a place of peace and silence and contentment. There is a principle of santosha. So we have a very yogic environment in our operating theatre. Sometimes you have nice music playing in the background. Once the mother is in the operating theatre, she is given an epidural, and the anesthetist will monitor her blood pressure and other parameters to make sure that she's comfortable and that she is safe. Anesthesia has improved so much from 10 years ago. It is actually now quite safe, in fact very safe, and it does work. So we would then make an incision which is about this big, just enough for the baby's head to come out, just on the bikini line, and it heals very nicely, and sometimes you just see a fine silvery scar. After the incision is made on the outer layers, we would make an incision in the uterus and remove the baby. The baby will then be looked over immediately by the pediatrician to make sure all is well, and then pass back to the mother, or probably just to go outside for the father to have a quick look, and then pass back on immediately to the mother to be latched on. At our clinic, we also teach lactation, so the mother would know how to breastfeed the baby, even in an operating theatre. So whilst the mother is breastfeeding the baby and bonding with the baby, we clean up, which means we sew up the inner incisions. We sew it all up, we suture it, and we close the superficial layer with a tape. The tape will go across, and the mother will then wheel into the recovery room to bond with the father and the baby together, the family together. And then when she's back at the ward, some gentle yoga exercise can commence, which means moving your fingers and toes and just bringing circulation back. Generally, we get the mother on her feet and sitting up in the first 24 hours. Excuse me, in the first 24 hours, and obviously there's some discomfort, but birth is, after all, it would involve discomfort whether it's natural childbirth or not. So generally the patient's all well and everything returns back to normal, and we've delivered safely with a baby. So I just want to say to you, if you need a cesarean birth, don't feel cheated that you've not had a natural childbirth or the childbirth of your dreams, because really sometimes we don't live in an ideal world, and if your need takes you to the hospital, so be it. If you come to us, we will do our best to give you the birth you want, even if it's an operating theatre. Namaste.
Om Bhurбhuvah Svaha Tat Savitu Varenyam Bhargo